Youth. I'm supposed to look anywhere. Oh Jesus, have mercy. I wanted to also find out. My research topic was on factors influencing malnutrition in children from 6 months to 2 years of age in the Asante Akim North District. I took this research because I realized that in Ghana, according to the United Nations Children's Fund, close to 1 in every 5 children under 5 years is stunted, while 1 in every 10 children under 5 is underweight. Almost 2 in 3 children between the ages of 6 months to 2 years are not fed food that supports their rapidly growing bodies. So in turn, these children are put to serious risks such as poor brain development, weak learning, low immunity, increased infections, and in many cases, these children die. So I took this research to be able to determine the knowledge that these primary caregivers of the children had on childhood nutrition. I also wanted to find out the feeding practices that these primary caregivers adopt in feeding their children. Also, I wanted to find out the influence of the socio-economic status of these primary caregivers on the nutrition of their children. Lastly, I wanted to find out the strategies that these primary caregivers think can be adopted to help reduce or curb malnutrition amongst their children. In my research, I found out that the knowledge of these primary caregivers was adequate, and most of them attained their knowledge from the antenatal clinics, which I think is a very laudable effort on the part of the health workers in the district, since they are doing a very good job. Also, I found out that most of the children that were malnourished happened to belong to primary caregivers who had low level of education or had unskilled jobs. Also, these primary caregivers happen to have partners or husbands who were not earning enough at the end of the month, at most about 30 to 50 Ghana cedis a month, which was not good enough to support these children. Also, I found out that most of these mothers were practicing the needed or the recommended feeding practices as recommended by the WHO, which was exclusive breastfeeding for 6 months and then complementary feeding from 6 months to 2 years of age. I also found out that majority of these mothers thought that giving children balanced diet and then practicing these good feeding practices as recommended by the WHO can help reduce the malnutrition in the district. To conclude, Owen Arthur, a former Prime Minister of Barbados, once said, he who has health has hope, and he who has hope has everything. In this regard, I recommend that these primary caregivers and their partners in the said district are encouraged to take advantage of the many educational opportunities that they have in the district, the many educational facilities in the district, to better themselves so as to help them achieve or attain good works in the society, so as to help take better care of these children, since they are the future of the nation.